Hello everyone, and I'm Dr. Rashmi Sarkar. I'm a senior professor in dermatology from New Delhi, and my special interest is of course on, pigmentation, with hyperpigmentation being a favorite topic. And I'll be talking to you today about a very important topic, what we deal with, facial hyperpigmentation, the psychosocial impact and different therapeutic options, and we'll also focus on one or two very important therapeutic modalities. So I'd like to thank Zydus for an academic grant for this program, and also to DocMode for being a technical partner, that is for this educational initiative. So I'm going to take you through facial hyperpigmentation, psychosocial and different therapeutic options before we come to important ones. Well, we all know that pigmentary disorders are the third most common dermatological disorder that we all see in our outpatient, especially facial hyperpigmentation, which can result in significant cosmetic disfigurement with subsequent emotional impact. That's really important. Now, most of these disorders like melasma, in which the common etiopathogenesis is still unclear, it's due to a number of reasons, but we all know that this particular pigmentary disorder has a severe impact on the quality of life. This causes a deep psychological and social stress. Now, patients with melasma feel frustrated, embarrassed, and depressed, and this affects their interpersonal interactions. Now, the thing is, usually the patients of melasma are women, and that also in their 30s. So this is a time when, women are very active. They like going out, with their families. So this is something to be concerned about, and that's why better and better treatments for melasma are required. The Melasma Area and Severity Index, the MASI, was developed for the assessment of melasma, and it reliably measures the clinical severity of melasma and is also able to monitor the changes after therapy. But the psychological impact of melasma, with its disfiguring facial discoloration, which is mostly brown, and also a very chronic nature, which we all know, definitely has a profound negative effect on the patient's quality of life. And this again is not captured by the MASI. So accordingly, the therapeutic decisions should not only be based on the clinical aspects or the MASI, but should also include the psychological impact of melasma. In fact, for more and more diseases, it's important to measure the psychological impact both before and after therapy. Treatment is definitely very challenging for this very recalcitrant condition. And moreover, there's no universally effective therapy. And existing agents definitely have varying degrees of efficacy. An initial evaluation and treatment of medical factors. Yes, there are medical factors, maybe thyroid abnormalities, photoprotection, which remains a mainstay, and triple combination cream, though given very cautiously, works well and should be rotated with other non-hydroquinone containing agents. Of course, there is also an individual preference. In all, for daytime application, multiple therapies currently exist, and out of these, there are several demelanizing agents, broad spectrum UVA and UVB protective sunscreens. But more importantly, one of the other important therapies are cosmetic camouflage, and these can be decided along with treating the underlying causes of hyperpigmentation. So this is a holistic treatment that you treat the underlying medical causes if they're there. You also give photoprotection because sunlight as well as UV radiation as well as visible light are important. And along with that, you give demelanizing agents. And lastly, when it is just about enough to be concealed, the cosmetic camouflage. And this remains a very important part of the treatment for facial hyperpigmentation. So thank you very much.